So that's good. So you got your sleep study done, you're on your CPAP unit, and you're able to be compliant with it, and that's huge. Now, the other thing was your asthma. You're dealing with that, and I understand that the medications you have, you're not always taking them. Is that correct?
Well, the puffers, the asthma puffers, I don't.
Yeah, I know what you mean.
Or the disc. I don't always, suck the powder all the time out of it. And then I realised later that I do when my wife tells me that, my breathing, where I'm trying to drag air in, she can hear me go.
You're wheezing.
Yeah.
Yeah, yeah. What kind of asthma do you have? As in, do you know what triggers your asthma?
No, I wouldn't have a clue. But if I go outside on a hot day, and then you've got that steamy hot day, I can't breathe in that sort of weather.
Yeah, and you kind of got a lot of that down in Alabama, don't you?
Yeah, or like later on, I'll be cutting the grass, so that will be a hard sort of breathing. Yeah. Also, but that's all right. You just have to get over it.
So you have the discus, the Advair.
Yeah.
And that's supposed to be taken twice a day.
Yeah, well, I don't always do that, and it's not that I'm not doing it health insurance wise. It's just that somewhere along the line I either forget about taking it.
Sure.
Or
it's meant to be used 12 hours apart. Well, and a lot of people, because of that, sometimes you forget. Sometimes if you put it around, not necessarily in the bathroom, because it's a powder, and if it's in the bathroom, the humidity from the shower and stuff will gunk up the powder. But if you can keep it perhaps maybe close to the bathroom, a bedside table, and when you brush your teeth, before you brush your teeth in the morning, use it.
Yeah.
And then that way you can do your mouth care and gargle and get that stuff out of your mouth. And then in the evening, perhaps, as close to 12 hours as possible after the morning dose, try to do it again. The purpose of it is, it decreases the inflammation in your airways and it keeps the constriction down so you don't wheeze. But again, untreated asthma symptoms, those little wheezing that your wife hears, tightness of the chest, those things, over time, untreated asthma symptoms, Paul, will cause reduced lung function. So it may not be such a big deal now, but down the road when you're not breathing as well, because oops, I forgot to do it occasionally, it may make you more of an incentive to use it more often if you know that.
Well, actually, I didn't know that it would actually, if I didn't use it now, maybe 5 years from now, I could actually affect me a lot more.
Absolutely.
Tell me, does the CPAP machines, and because you're a breather, what sort of special?
I'm a respiratory therapist.
All right. Well, as I said, I'm recording you on YouTube right now, the voice. But using the puffers and using the CPAP, would that actually go a lot better hand in hand?
Not really. Two different things, to be honest with you.
All right.
Okay. The sleep apnea is due to some sort of an obstruction. Usually, when you fall asleep, the muscle tone in the back of your throat relaxes, and it tends to collapse on itself, and you either snore lightly or you completely obstruct and you don't get air. The asthma is down below in your airways.
Yeah.
Okay, so it's really two different things, two different beasts that you're treating.
But I actually thought that even though having asthma, it would actually, the both would help each other, even though, with breathing, but I guess that I was wrong.
Well, good thinking, but yeah, they're kind of unrelated, really.
Okay, no problem.
Okay.
So what sort of help do you offer in the way of teaching about breathing? Is this the sort of conversations that we would be having?
Yes, sir.
Oh, that's good. Well, there's not too many other conversations that I think I would have with you.
Well, I don't know about that, Paul, but
yeah.
This is the one I get paid to do, and it's what I enjoy doing, and it's really nice when I'm talking to somebody that's receptive.
Yeah, well, I want to actually, I want to keep note of this, and that's why I'm still recording, instead of just saying, oh, yeah, and nod my head and be done with it.
Yeah, yeah. Hopefully you get something out of it. That's what it's all about.
Yeah.
So if you can walk away with this conversation of, yes, I should use my Advair twice a day, the more you use your Advair, or if the more you use it as it's prescribed, the less you need to use your rescue inhaler.
Oh, okay.
The albuterol.
Because I find the rescue inhaler to be more effective than I think using the other one. But I don't use the other one enough, the disc,
right.
so to actually know the difference.
There's two different kinds of medications really for treating asthma. You have maintenance medications, which are those that are used to decrease inflammation in your airway and make your airways less sensitive to those things that cause the symptoms. So if you make your airways less sensitive, you don't have the symptoms, thus you don't need the other medication, which is considered to be a rescue inhaler.
Oh, okay.
The albuterol is meant to be used only when you really feel the symptoms coming on. The goal is to use your controller daily, so you don't need to use the rescue.
Ah. Well, see, what happens is usually a doctor, and I know people benefit from hearing this, but usually doctors prescribe things that say take it daily, thank you and goodbye. But you don't sort of understand what the reason is.
Correct. There's a time factor there.
You know, and that's something that, go home and read the information pamphlet. Well, the information pamphlet is great to read, but a lot of the times you still don't know why you're taking it, even though you know that you've got a symptom of breathing. So I would say that this information that you have shared, and I guess we'd probably have another conversation at a later stage. Would that be correct?
Absolutely. If that's what you'd like, I can call you in a couple weeks, a month, or 6 weeks, and if you start using the medications, I call you back and we talk and see how things are going, and then maybe we can talk a little bit about what might be causing your symptoms of asthma. Because ideally, you play a detective. You say, okay, I've got asthma and something's causing it. Well, if I figure out what's causing it and I can either eliminate it or avoid it, I may not need my medications at all.
Well, actually, what the main cause of lack of breathing or trying to breathe to stay alive is when I used to smoke cigarettes.
You no longer smoke?
No.
How long?
Going on, I think, 3 years, going on 3 years now.
That was a pretty smart thing you did.
It's just that I started not being able to breathe.
Yeah.
And that was causing panic attacks. Also. So I was at my brother's house one day, and they don't smoke, and they always kept saying that I smelled funny, because they weren't around smokers. And no matter if I washed my hands and brushed my teeth, I'd still have some sort of smell on me. And I just decided that, I decided I wasn't going to give up. I decided not to smoke, if that makes a difference. I still want...
Yeah, it's a psychological thing. How do you look at it? If we love something and we feel we're being forced to give it up, then our natural reaction is to fight back and not do it.
Well, I still want to smoke every day, every hour.
It's a really powerful drug. It's a wicked addiction.
Oh, sometimes I like hanging around people and just getting that little... Oh, but
You're tempting. You're playing with fire, Paul. No pun intended.
I know, but that's the addiction side of things.
Yes, it is very much so.
But the thing is that was the trigger that actually, when I was smoking, they were giving me the albuterol to sort of counteract that I could breathe, and they were giving me the Advair to counteract that I could still breathe also while smoking.
Mm-hmm.
So I'd take a puffer, and then I'd have the Advair. I'd suck that too, and then I'd go and have a smoke because it felt better, But before then I was wheezing, I was like that, and then I'd have the puffers and all that, the medicine, and then things would be better again.
Yeah.
And it was actually counteracting. So I don't know if in time the lungs will ever fix themselves up again. But I'm sure that by not smoking, they're fixed where they can.
You're not doing more damage to them, Paul. That's the most you can hope for, you know.
Yeah, they can just survive. So
Yeah, yeah,
um,
yeah.
I'm gonna just stop this recording and then I'll talk with you.
Okay. Well, okay.